The straight leg raise test, or the SLR test for short, is a physical examination technique that aims to assess the patient for certain problems stemming from their lower back to their legs, such as nerve root irritation, neural compression, disc pathologies like disc herniation and disc degeneration. This test is able to gauge patients for such problems in a non-invasive way. If a patient meets up with you for a medical appointment and one of the things they talk about is pain in their lower back and or legs, then you may want to perform the straight leg raise test on them. Since the straight leg raise test is a physical examination technique and can definitely be conducted by numerous healthcare professionals such as orthopedists, neurologists, primary care physicians, osteopathic physicians, physical therapists, and chiropractors. To use our free straight leg raise test, follow these steps. Download our straight leg raise test from the Carepatron platform, which you can find in the link in the description. The straight leg raise test is one of the easiest physical examination techniques to perform. It doesn't require any special equipment. The only things that you need are a comfortable examination bed and your 2 hands. We also recommend that you have a goniometer and someone who can use it since you will be busy handling the legs. Firstly, prepare the examination bed. Have your patient lie down on the bed in a supine position. Make sure that their legs are straightened and their feet are pointing upwards. Position yourself on the side of the patient. Use one of your hands to grasp the patient's ankle. Place your other hand on the knee to provide support. Slowly lift the leg upward while keeping the knee extended while you're doing this. Observe the patient's face to check for signs of discomfort. Make sure to observe the angle of the leg. If the patient shows signs of discomfort or actually tells you they are in pain when you raise their leg and reach a certain angle, that may be indicative of what the possible issue is. If you have someone who can measure the angle with a goniometer while you perform the technique, that would be great. Make sure to perform the test on the other leg. Here is an example of our straight leg raise test, which you can find on our Carepatron platform. To find our straight leg raise test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.